We've got a quorum, so welcome to the first meeting of the Subcommittee on Health and Human Resources. Before we start today, I want the members that are here to introduce themselves, and we'll start with Senator Reeves.
I'm Senator Reeves, neighbor of Senator Deeds over in the mountain area of Greene, Madison, Rappahannock, Fauquier, Culpeper, Orange, and Wisconsin.
Yeah, I'm Creed Deeds. I'm the 11th District. I represent Charlottesville, Albemarle, Nelson, Amherst, and part of Louisa. Senator Favola?
I'm Senator Favola, and my entire Senate district is contained within Arlington County.
Hi, I'm Jennifer Boysko. I represent the newly created 38th District, Herndon, Reston, McLean, Great Falls, and Wolf Trap.
Okay, as we begin today, I want to note that the Health and Human Resources Subcommittee covers 30% of the overall state budget, includes a wide variety of programs and services for a whole lot of people. Balancing the funding needs for this area is never an easy task and can be challenges as the needs are always greater than the resources available. The subcommittee will have 5 meetings until we report out the Senate budget. We will start today with remarks on the governor's proposed budget from the Secretary of Health and Human Resources, and then have a budget briefing to better understand the governor's budget for the Department of Social Services. In future weeks, the subcommittee will receive briefings from other HHR agencies, including a staff overview of the budget issues before the subcommittee, and consider any HHR-related bills referred to the committee. I want to note that in the past, we've met on Monday afternoons because I took over as chair of Commerce and Labor. What Monday afternoons were no longer available. This is not the best time because at least two of our members are on Education and Health, which meets at 8 o'clock. So we're kind of on a half-hour window of where we'll have a quorum. We're not going to make any decisions today, so we can keep going. But today we have Secretary of Health and Human Resources, John Mattel, Dr. Danny Avula. I didn't see Dr. Avula.
He's on his way. He'll be here.
Mr. Secretary, thanks again for being here today. Please get us going.
Thank you. Good morning, Mr. Chancellor. I'll talk fast. Next thing, and you must be your growing up on a farm that we start at 7:30 in the morning, so it's going to take me a little while. So if I make a mistake, that's fine. But I appreciate being here today to talk about what we've accomplished over the past 2 years and highlight. and reduce administrative burdens. In 2022, 2,619 Virginians died from drug overdoses. In 2023, preliminary data suggests that that has increased to 2,640 fatal drug overdoses. That's 2,600 too many. This budget uses revenue from the opioid settlements to reach youth and inform them of the dangers of fentanyl and other illegal substances, allows VDH to provide no-cost or low-cost naloxone, and supports adolescent substance use services. One of the most significant activities we have undertaken is the reprocurement of the Medicaid Managed Care Program. This will allow us to better focus our resources on behavioral health, maternal health, and foster care, as well as provide better protection and accountability for the Commonwealth. The budget includes funds to continue the implementation of this effort. We know that hungry children are not able to learn properly in school, and often kids who qualify for free. Yes, sir. Yes, sir.
Mr. Secretary, going back to the 2,619 deaths,
Yep.
how many of those were part of or attributed to fentanyl?
About 75.8%.
Wow.
So in 2022, I think it's about 2,050 deaths were attributable to fentanyl. In this year, say 75% of that, so it'll be a little bit higher, maybe 20, or last year, 2,100 attributable to fentanyl. All that is, counterfeit pills and things like that.
Right. Thank you. Thank you, Mr. Chairman.
Thank you, Mr. Secretary.
Related,
Senator Favola's got it.
Yes, ma'am.
I don't know, I know Carl Ayers is here, but what percentage of our children entering the foster care system are entering that system as a result of the opioid epidemic?
Do you know the answer? Then please come up. When you start talking percentages, you're going to stump me, so.
And again, I'm just looking for
Steak dinner.
rough
That's all I got to
estimates.
say. Steak dinner.
I got to get up and get you that steak dinner. So, good morning, Mr. Chair, Senator Favola. So, about 70% of our youth that enter foster care are involved in some type of substance use disorder related to their parent. The opioid epidemic, because of our antiquated child welfare system, we can't split it out by which specific drug it is that they're involved in, but it's roughly
But
about 70% of their
So, I mean, this is the impact it's having on our
Correct.
children.
That's correct. So, thanks,
Thank
sir.
you. You can stay and keep going if you want. I was talking about hungry children. So this budget, the omnibus appropriations bill that Congress passed last year, established a permanent summer lunch program for school-age children to receive federal funds. The governor's budget includes over $5 million in state matching funds to administer that summer program for about 850,000 children who will qualify for that. During the past year, HHR and your staff have taken a hard look at our TANF block grant. Previous grant balances have allowed us to maximize federal funding and utilize TANF for discretionary programs, but those discretionary funds are running out. This budget right-sizes the TANF block grant by returning some programs to the general fund. I thought he was switching sides. It'd be really exciting.
Mr. Chairman. Just another question. When you say right-sizing TANF, so am I to understand that in your budget, the TANF allocation is for the Category 1 directly to families and not for the subsequent categories 2 and 3 where we supported programs that were ancillary to the direct payment?
Yes and no. So we have moved most of it to Category 1. There is still a little bit of supporting programs. One of the things that we looked at were programs that we supported, statewide programs that really are a function of the state versus wonderful programs in localities that need funding. And so we tried to move the things that we thought were the function of the state into general funds to make sure that we're paying for those and limit it. So we're not in a place, we did not reduce or eliminate many or maybe not any of those programs, but we did kind of try to make an assessment as to are these statewide programs that really meet a function of state government. So for instance, the home visiting program was funded through that. Obviously a very important program. It should not be considered discretionary. So that was moved.
I just want to note for the, I guess, enlightenment of the audience and others, I'm sure my colleagues are aware, that will leave a number of sort of nonprofits who have traditionally received money, TANF money, without a necessarily straight pathway to additional funding.
We can send you the breakdown on that. It is in the budget, but we can break it down for you as to which.
I think that would help me,
Okay.
actually, and I think it would help the committee. Thank you.
Mr. Chair.
Senator Boyce goes.
Thank you. Mr. Secretary, thanks for being here. Can you explain why is it because we have allocated so many of the TANF dollars that we've run out, or what is the background on that?
Well, the sort of short answer is, and I was very excited when I came here because when I was nominated, a lot of my friends told me, "Oh, you're going to have so much extra funds in TANF." Tennessee had $900 million surplus funds, and when I got here, one of my first questions was, "How much of a surplus do we have?" We did not. So we have had a shortfall that's been in the system that has just been pushed forward every year. So we have had a surplus of TANF dollars that were not being used for the TANF purposes that were coming in, and a sort of a built-in sort of systemic shortfall that was there. And in this budget, we have to address that. So, and a lot of it has been, just as the budget has been developed over the past, several years, whenever you can move stuff into non-general funds, that's what everyone wants to do. And so we had a lot of programs, as Senator Favola noted, that are really good programs, local programs, homelessness programs, food programs, things like that got funded in the non-general funds. And so when we get to this point, we have a significant amount, I think it starts at $14 million and goes up, that we have to cover. And so I think in the biennium, was it a $30 million shortfall that we're trying to cover?
That's pretty, and we have additional. Yeah, so the commissioner is going to cover that in the presentation.
All right.
When he gets into it. So we'll cover more details.
All right. Thank you. The last item that I would, last two items that I'd take a look at is, I think you all know that Virginia remains well below the national average of 32% for foster care children that are placed in kinship foster programs, and remains one of the lowest nationally of children in foster who are placed with relatives. The governor's budget will support our foster care system and provide incentives for children to be placed with relatives or kinship foster parents. Permanent placement stability is a critical factor for us in protecting children from ongoing trauma related to repeated introduction to strangers as caregivers. The last item I want to hit on is a continued commitment to our emergency medical services community. In an effort to improve financial accountability and transparency in the Department of Health, we exposed long-standing financial mismanagement in the Office of Emergency Management Services. While VDH takes aggressive steps to bring spending in line with resources, additional temporary funding is included in this budget to make certain that OEMS is able to pay their obligation to localities, EMS councils, and rescue squads throughout Virginia. As the chairman noted, Health and Human Resources is a sizable budget, $30 billion, representing about a third of the Commonwealth's spending. We're committed to managing that as well as we can and as transparently as possible. I want to thank Mike Tweedy, April Keys, and the staff here for their partnership and also for their patience. The historic and holistic knowledge that they bring to us has been very, very helpful as we navigate a number of issues. These are just the highlights of our budget, and I know our agencies will be testifying over the next few weeks. I have some excellent agency heads and finance staff, some of whom are here today, and I also want to note our first CFO in HHR, Lynette Walker, who is here to answer any questions as well.
Okay, thank you. Are there additional questions for Secretary Littell? Thank you very much.
All right, thank you.
Dr. Avula.
Good morning, Chairman Deeds, members of the committee. Wonderful to be with you all this morning. I'll just start with the question that Senator Favola asked. Our shortfall in fiscal year 23 was $31 million. And so that went and dipped into that backlog, that reserve of TANF dollars. And that reserve is down to about 60 million, and unless we address this over the next couple of years, it will completely go away. And so that's why the governor's budget really does address making sure that that is balanced and that we're not dipping into that every year. Okay, I know you guys are on a short timeline, so I will maybe just a couple of notes, a reminder of how we're structured. The state agency oversees and supports 120 local departments that are all a part of their local government. So unlike the Virginia Department of Health, where the entire public health infrastructure is a state employed, we are not. We have about 1,800 employees that are state employees, and then over 9,000 that are out in the field. But our job is to create the oversight policy infrastructure to support that local operation. So the state supervised, the locally administered programs include family services, so foster care, adoption, child protective services, benefit administration, SNAP, TANF, child care subsidy, and Medicaid, and energy assistance. And then I'll just note that we have a nonprofit arm of the social services system called community action agencies. And so there are 31 nonprofit community action agencies around the state. They get funded through community services block grant and really very much are aligned in mission and in the work of helping people out of poverty. We also have a number of programs that are administered at the state level, including the big one, child support enforcement, adult and child welfare licensing, so our assisted living facilities, and then we oversee the refugee resettlement program, along with a number of other programs that you see there. Here's a snapshot of kind of the overall spending through social services into the state. Totals about $24 billion. A large portion of that is Medicaid. And then here is the breakdown of how we're funded, because we do have a very complex budget that includes federal, state, local match, retained collections, grant funding, and so you see that here, and it's about 38% federal funding. And everything that we put out to support the local departments is matched by a 15.5% local match. Now, here is the general fund breakdown of what a total of $483.9 million of general fund. The bulk of that goes to support local operations. So this is staffing, and obviously all of this comes with a federal match, but it goes to support local operations. That $109 million in family services and $91 million in benefit programs. Again, that's the state portion of much of this, which is federally supported. Adult programs in there, that $23 million includes the auxiliary grant, which is the funding source to provide slots at an assisted living facility for low-income adults who may need that support. All right, a snapshot of our foster care and adoption program. So this is a big focus of our agency, a big focus for the governor. And right now we have 4,353 kids in the foster system. As a point of reference, this is a much lower number per capita than many states. Indiana, as an example, has a total population of about 6.8 million, and they have over 13,000 children in foster care. Washington State, which is about 7.1 million, they have about 10,000 kids in foster care. So Virginia, by and large, does a really good job of addressing and assessing situations, deciding who needs to come into the formal foster care system and who might fall into other foster care prevention situations. So identifying relatives and other pathways for kids who don't need to come into the foster care system. In the bottom right, you see the number of kids who are with relatives and receiving financial support for those relatives through relative maintenance payments, 1,643 kids. One of the things that's proposed in this budget is a significant expansion of funding to support relative maintenance payments for kids who may need some kind of support to come into the foster system, but where we could identify a family member or fictive kin member to support them better. I think all of you or most of you were at the presentation I gave back in the fall, where we went deep into kinship care and talked about a lot of the outcomes for that population. But it's what we know is that health, social, educational outcomes are better for kids who are rooted in family and rooted in community, and so that is why we are really focused focusing on shifting the total number of kids in foster care to be in kin placements. Right now, you see that 2,800 of that 4,300 are in non-relative foster homes. We really want to see that shift up to the top line there to the kinship number, and so that's a big effort of our agency right now. In the upper right, you see the number of kids who are supported financially in adoption. So about 8,600 kids who continue to receive financial assistance, families who have adopted children who continue to receive financial assistance. The reason that is broken down into 4E and state adoptions is the funding source. So back in 2019, federal legislation around Family First allowed for adoption payments to be supported by 4E. And so we have since then shifted all of our adoptions possible to be fully funded through that federal funding stream. There are some adoptions that happened before that that don't qualify, and so those are still funded by the general fund. So that 711 number should trend towards zero in future years, while the funded by 4E should trend up. Okay, let me see where. Yeah, this is a snapshot of just the total number of people who are supported by the DSS system. As you all know, during the pandemic, there's a huge expansion of people covered by Medicaid, and so that number is up to 2.1 million. But you can see the numbers there, 453,000 SNAP households equaling 886,000 participants. The one breakout that I'll just point out in the TANF cases, that 14,789 cases are the ones that are funded through the federal TANF block grant. The TANF unemployed parent program, that UP program, that is actually general funded. So years ago, this body, the General Assembly, decided that families that fall into a certain category, two-parent families where one is not working, we didn't want that to count against the federal benchmark of 90% workforce participation. And so we created a separate general funded funding stream to support TANF payments to that group of people. And so that's why we split that out there. Here, the yellow line is one to pay attention to. That yellow line is the child care spending, and obviously there was a huge infusion of dollars during the pandemic. The governor has taken this very seriously and has proposed a significant investment in child care. We know we need to support working families. We know we need to improve access to child care. Okay, on Medicaid unwinding. So, over the pandemic, we were not allowed to remove people from the rolls of Medicaid, and so those rolls ballooned to a total of almost 2.2 million individuals. The good side of that is that lots of people were covered through the pandemic. The downside of that is that, since the pandemic's resolution, there are many people who have moved out of state or who have moved into jobs where they now are insured through other means. And so our work has been to right-size those roles. This has been an all-hands-on-deck effort, weekly meetings for over the last 2 years. And I just want to point out an amazing partnership between DSS and DMAS to really get this work done, and then an incredible effort by our local partners, the local departments of social services that are doing the work of redetermining all of these Medicaid cases. On the right, you see a dashboard that shows we're right about a little over 1.5 million, 9 months into the unwinding process. This is the total number of redeterminations that local DSSs would do in any given year, in any given 12-month period. And so we will hit that completion number in about 5 months, and we're well on target to do that. It's really been an enormous effort, but I think we're in good shape. Okay, so we get to the proposed budget amendments here, and this is just an overall, I'll go through these categories on the left, but this gives you kind of an overall look at what is in the governor's proposed budget for DSS, and we'll start with the unsexy work of IT transformation. So as I mentioned, one of our core functions is to support the work of local departments. And one of the main ways we do that is by supporting their IT infrastructure. This is 12,000 users across the state between state and local departments. And we have used really antiquated systems. Thankfully, you all have approved huge infusions of funding over the last couple of years to help us get modernized. Two main systems that touches. The first is the child support enforcement system, which was a 28-year-old system. We are now replacing, we're under contract, that work is underway. It's very exciting. But in the process of putting out an RFPs and recalculating how much that would actually cost, the price tag was a bit higher than we expected. So we are asking for an appropriation of $15.5 million of non-general fund. That's 2/3 federal match and 1/3 retained state collections. And so that's to help move the child support information system forward. The second ask, and the second thing you all have appropriated in the last couple of years, is the child welfare IT system. We are in the RFP process and making good progress through the federal approvals and finding potential vendors. But we're asking for a rollover of unspent CC-WIS funding, the child welfare information system funding. All right, the next bucket is around child welfare outcomes. And so we've talked a bit and previously at length about kinship care. The bill here, or the budget proposal here, is for an expansion of relative maintenance payments, which would allow many more children to go and be supported by relatives. And then the $6.3 million that you see there in 2025 is largely the cost of living adjustments around foster and adoption payments. Secretary Littell mentioned the summer EBT program. So this is pandemic EBT that the federal government is now making permanent. That brings about $98 million of food benefit into the state every year, but the feds do not cover the entirety of the administrative cost. And so what's represented there, $2.9 million, is the state share, 50-50 share of administration of the summer EBT program. The one note I'll make, and this is addressed in the caboose budget, if this is approved and we would get this funding starting in July, we would really like to start the administration in June for this summer, which means we need a little bit of lead time. We'll need, really February, March to start building and preparing for that administration. So there's a small amount of money in the caboose budget to help with that ramp up. Fatherhood program. So again, a big focus of both the agency and the governor is to figure out how we re-engage fathers. I've been involved in a number of cases in my short time in DSS, whereas we're looking for family, we're only looking on the mom's side of the family tree. And so that is one of many examples where our system has detached and disengaged fathers. I think there's a lot of important work we can do to re-engage them and make meaningful impacts in the lives of children. Yes, sir.
Doctor, I think it's great that we're trying to get more fathers engaged in families and that. What are the metrics that you gauge success?
I think initially it's really tied to our kinship program, right? Because right now, the slide I showed you earlier, we have 4,300 kids in foster care, but only 600 in kinship placements. We really want to shift more kids into those families, whether that's the father or a paternal grandparent on the father's side or a paternal relative. I think we can, so that's one metric.
Mr. Chairman, so you're going to have a baseline number you're going to start with when you get that money, and then you're going to say in a year you're going to come back and tell me how many fathers we got placed and what that cost dollar per father was and all that sort of stuff. You can break it down?
Yeah, we'll be able to do that.
Okay. Thank you, Mr. Chairman.
Mr. Chairman,
She has to go to Education Health soon, so she's
soon
got to
to
get a
my
question.
last question, and my apologies. I
problem.
am going to have to leave before your presentation concludes. But on the Medicaid unwinding, am I correct to conclude that we still have about 1,500 people that we have yet to determine their status?
About 500,000.
500,000, not the 50. Okay, got it. Okay, so the 500,000, when will you conclude that some of them, I would expect, would be able to remain on Medicaid,
Yeah,
and others may not?
That's right. I mean, if you look at what's been done so far, 1.5 million redeterminations have happened, 1.26 million have been renewed. So a significant portion of the people who are being determined are found to be legitimately eligible for
Right.
Medicaid. So, you know, if those percentages hold, I would guess that about 350 of those 500,000.
Mr. Chairman, just a follow-up. So of those who are not eligible for Medicaid, where are they accessing insurance?
So sometimes they're deemed to be not eligible because they're already insured through other means. Either they've moved to another state or they're employed. And then otherwise, we're referring them to the health benefits exchange to try to buy
And they
insurance
may or
through the
may not
markets. That's correct.
participate in that. Okay. At some point, Mr. Chairman, I think it would be worth knowing, if you can determine that, how many individuals are still left without insurance, as much as we've tried. And we've referred them to the exchange, but they may not, for whatever reason, cost or other reasons, not participate in the exchange. I would just like to know what the gap is.
Yeah, I think it's an important thing to
Thank
flag
you.
and pursue. Thank you, Senator. Okay, I think we
One
got-
more question, Mr.
Senator Boysko's got a question because she has to go too.
I also have to go as well. So as you were talking about how we are going to be investing in our information technology, and you mentioned that some of the funding would come as a rollover of unspent funds. One of the concerns that I think several of us have is that we're assuming that certain things are going to either not be spent in other programs, and then we're making that assumption that it can be used for another use. For instance, what you just talked about. Can you give me any information on how we're moving things around?
I mean,
And
for the CWIS, that I can't remember the total dollar amount. Maybe Carl knows, but that was appropriated 2 years ago, and so we are not using that funding for any other purpose than the planning and preparation and execution of the CWIS system. Now, you know. But the runway is a long time. You know, it takes a year just to get through the federal approvals process, and so that's why we have not spent the funds that were appropriated. I think with this appropriation and future IT appropriations, I do think it just is a reality that the feds need an assurance of commitment of funding, but because we do biennial budgets, we're never going to be able to spend all of that money in 1 2 year period. And so I think we do need the ability to roll that over, but we don't pull money from that for any other purpose. Okay. All right. I think we can move to addressing audit findings. So there's a couple of things that have come up annually on audits for us. One is that our local department staff, by federal regulation, have to have background checks. Now, this isn't currently a part of our practice. I mean, a lot of people do it, but it's not a required part of our practice. This funding would allow us to finish off the remainder of local department staff who need background checks. And then we, in running the SNAP program, one of the metrics we look at is our SNAP error rate. We have reviewer positions that are part-time positions currently, a small amount of funding to make those 5 positions full-time. Adult welfare outcomes. So one of the things the Department of Social Services does in support of DARS is that we fund a hotline for both CPS and APS calls. We've really struggled with the volume of calls that we receive in that hotline, and so this is an expansion of capacity to lower wait times. I mentioned the auxiliary grant earlier. We have seen just nowhere near enough utilization of the auxiliary grant. And so this increases the rate, which makes it viable for ALFs to actually take the auxiliary grant and find placement for low-income individuals needing those services. The Judge Sweat Learning Center is one that has come off of TANF funding into the general fund. All right, and then contractual obligations. So we talked about, EBT funding. We have a contract with a vendor, and the cost has gone up there, and so there's a small amount of funding there. Ensuring continued requiring income verification. So this is a large amount of money that would go to Equifax, which is the company that we use for income verification. Their prices have soared. We have worked with the chief procurement officer to try to bring those down. This is an issue that multiple states are dealing with. I talked to my colleagues across the country, and they're all dealing with this this increase in cost for income verification. We'll continue to look for other options to keep those costs down. We didn't move, or in the process of moving, where our landlord decided not to renew our lease. He wanted to turn our downtown building into apartments. So we have a new home out in Innsbruck. It triples my commute, but it shortens the commute for many of our staff, and it gives them free parking, which they're thrilled about. Also, the rent is cheaper, and so there's some cost savings there. A few technical amendments here, just an appropriation needed for refugee resettlement. These are all federal funds. A removal of some reporting requirements, rebasing, and then an appropriation of money for 5% increases in local staff and salary. Okay, and then mandated amendments here. So there was, in the first one there, the SNAP benefits over issuance. You all may remember a couple of years ago, there was a miss in terms of the date that there was an increase in SNAP benefits issued. That went in a couple of days early, and we ended up overpaying SNAP benefits by about $6 million. We have negotiated that down with the federal government and have negotiated that down to a $1.4 million payback. And then funding the changes in child welfare forecasts, which are actually a savings, and then an increase in the child care forecast, and a slight shortfall in TANF. All right, and so here's the caboose bill. I mentioned administration of the EBT, the summer EBT program. We do have this need for income verification services that I mentioned with the Equifax, and then the salary increase that was approved by the General Assembly and also has an impact on our local staff. A couple of other forecasts, and I mentioned the benefit over issuance. I did say, so it's $1.4 million that has to get paid back to the federal government. The remainder is a reinvestment in our SNAP program. Secretary Littell did talk some about the TANF block grant and really right-sizing that. So here are the specific programs that are being moved over. Resource Mothers CHIP and the contraceptive access that are really VDH administered programs. So those will move to the general fund in the governor's proposed budget to be appropriated and administered by the Department of Health. And then a couple of programs, Early Impact Virginia, which is the consortium of home visiting, and then competitive grants for community employment that we would like to shift to the general fund. There are 3 nonprofits that have not responded to multiple attempts by our agency to reach out to them, and so those will be eliminated from future TANF budget. I mentioned our move. Here's our new office in DSS. Would love to, in Innsbruck, out in the west end of Richmond. Would love for y'all to come visit at any point. Happy to answer any questions.
NGOs.
They are Cornerstones. Oh, sorry. Family Restoration Services in Hampton, Portsmouth Volunteers for the Homeless, and the Menchville House.
Okay, does anybody have any questions? Are there any questions from the committee? Thank you so much.
My pleasure. Great to be here. Thank you.
This technology is really cool. Listen to this. Well, it's gone. It's gone now. Wait. We'll rise.
Senate of Virginia, Richmond, Virginia.